Hi, Bertha. So the doctor has ordered for a discharge for you today, so you are going to be going home.
Who are you?
My name is Ashley. I've been your nurse for the past 2 weeks.
Oh, hi, Ashley.
Hi. Okay, so you're going home today, okay?
What?
You're going home today. Do you have a ride home?
My daughter.
Okay, do you need me to call her for you?
What?
Do you need me to call her for you?
Yes.
Okay. I'm going to take out your IV, and then you can change into your clothes, and your daughter will come and pick you up.
Okay.
Okay, I will be back in a minute, okay?
Okay.
Okay.
Ideally, the patient teaching should start preoperatively and include the patient's family and caregivers.
According to Sunderland, upon discharge, patients should be advised to keep the incision dry, wait until the 3rd day before having a shower.
Also, avoid raising the arm adjacent to the incision site for the first week.
For 1 to 2 months, do not lift, push, or pull anything that weighs more than 5 pounds, including groceries and children.
For the first 1 to 2 months, avoid arm exercises or activities like sweeping that require repeated movement of the arm.
Do not put pressure on the incision site, such as wearing braces or tight clothes, until the incision has healed.
People with pacemakers are still legally required to wear seat belts, but until the incision has healed, they may find it more comfortable to wear it across the shoulder opposite the incision site.
Tell your other healthcare professionals, such as your dentist, that you have had a pacemaker inserted.
Vigorous contact sports such as rugby, boxing, or judo should be avoided in order to avoid injury to the pacemaker.
A pacemaker may set off metal detectors or some anti-theft devices, so people with pacemakers should carry their pacemaker ID card to show authorities if required.
Do not drive until advised by the cardiologist. The DVLA recommends no driving for 1 week after the procedure for Group 1 drivers. People who drive large lorries and buses fall into Group 2 and are not allowed to drive for 6 weeks after a pacemaker insertion.
Inform your cardiologist if there is any recurrence of your previous symptoms, is any sign of infection in the incision site, such as swelling, fluid, pain, redness, or other unusual color at the pacemaker site, chills, or a temperature of 38 degrees Celsius or higher, and there are hiccups that last more than 15 minutes.
When providing the discharge advice, the opportunity should be used to disabuse patients and their families or carers about common misconceptions about pacemakers arising from popular notions or outdated information.
Myths and facts about pacemakers. Myth: now that I have a pacemaker, I can't use a cellular phone, go near a microwave, or pass through security systems.
Fact: you can use a cellular phone. Just hold it to the ear on the opposite side of your pacemaker. You can carry it anywhere except in your shirt pockets. Microwave ovens and other household appliances, such as hair dryers, are safe to use. When you must pass through a security system, such as an airport checkpoint, pass through quickly. If you'd rather not walk through a security checkpoint, show your pacemaker ID to security personnel and ask that they use a wand to screen you. The wand should be held at least 6 inches from your pacemaker. Myth: now that I have a pacemaker, I can't have x-rays or other medical procedures.
Fact: although you shouldn't have magnetic resonance imaging or MRI, x-rays and mammograms won't harm your pacemaker. Talk with your cardiologist before having any medical procedure. Myth: now that I have a pacemaker, I can't work on my car or any electrical appliance.
Fact: you can't work on your car and electrical appliances. Your pacemaker has features to protect it from most electrical currents. But if you feel dizzy or your heart feels as if it's beating fast, turn off the device you're working on and move away from it.